let's talk about the operations that we do and basically what anesthesia is used. For surgical procedures, these that are done as an outpatient, and most of mine are done either under a IV sedation, like twilight sleep that probably a lot of you are familiar with, or a general anesthetic administered, both of these by an anesthesiologist, an MD. The difference is that twilight sleep, the person is there, in other words, their body is there, but their mind is elsewhere. Whereas a general anesthetic, what happens is that the anesthesiologist actually breathes for the patient, so they're totally not there. Most patients prefer almost no anesthesia, but in most cases these procedures are quite large, quite complex, and maybe lengthy, and it would be very difficult to perform under no anesthesia. Patients have tried to do this, and again, if a person really is concerned about anesthesia, I try to minimize it as much as I can, but I always prefer that an anesthesiologist be there, simply because I can pay the most attention to the surgery that I have to do rather than having to pay attention to the anesthesia. Most of the surgical procedures that I do require anesthesia because they are long and sometimes complex. These can be anything from breast implants to a tummy tuck to body contouring procedures. Some patients require or request no anesthesia, but again, in most cases this is unrealistic. If very little anesthesia is given, a lot of times the patient may be more anxious. If they're more anxious, what's going to happen is their blood pressure is going to go up, and all of a sudden they're going to bleed more, and it's going to be more difficult to do the procedure. So I like to pay attention, as mentioned, to the operation that I perform rather than to both the anesthesia and the operation itself. You may have heard also about awake anesthesia, or no anesthesia, so to speak, for certain procedures. Again, I would be very skeptical because you're talking about major areas that you're operating on, large areas that need to be infiltrated with an anesthetic solution in order to achieve a pain-free and pleasant operation for the individual. What happens is that in most cases there's a limited amount of anesthetic that we can use. If we use more, then the potential for problems do definitely increase. So really, I would be very concerned if someone was offering me an awake type of an anesthetic. Again, this can be done for minor procedures, which I do in the office without a problem in most cases, with either local anesthetic or with placing of ice or different anesthetic, like a topical anesthetic on the area. But if you're talking about a major procedure, anything from a facelift to a breast augmentation or breast procedures, they do need a certain level of anesthesia to make you comfortable, and that's my goal, as well as to do it safely. So if you want, please come and visit me. I'm in Newport Beach. I don't charge for consultations. You can find me at 949-640-6324, or come and look at my web site, which is www.surgery-plastic.com. Thank you.